Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today, Dr. Mitika Kanabar talks about process addiction and how it relates to a new problem in today's youth, screen addiction.
Do you know how much time 11 to 15-year-old in the US spends in front of an entertainment device in a day? Hi, I'm Dr. Mitika Kanabar. I'm an addiction medicine, lifestyle medicine, and family medicine physician practicing in Southern California, and really happy to be a part of the UCI team. The answer for the question I just asked is 9 hours. Can you imagine 9 hours? How many hours does it make in a week, in a year, in a lifetime? Staggering, isn't it? Well, today I would love to talk about one of my favorite topics in addiction medicine, that is process addiction. What is process addiction? It's also known as behavioral addiction. Behavioral addictions or process addictions are essentially thought of as non-substance addiction. So when we think of the word addiction, we generally think of a substance, correct? It's either alcohol, tobacco, cannabis, and so on. However, there are certain behaviors that can also give you that dopamine hit that can be addictive in itself. And those are called as process addictions. Now, wait a minute. Then how do you even think about that? Is it even classified in any certain way? Yes and no. So gambling disorders have always been recognized for a very long time. Whether it was the DSM-4 or DSM-5, the nomenclature changed a little bit, but they have been recognized for a while. There are some treatments available and lots of data out there. The newer things that we see, such as, spending too much time on your phones or too much time on the internet, those are more gray areas. There are certain specific ones that have emerged, such as gaming disorder. Now, what's interesting about the gaming disorder is that it's not recognized by DSM-5 as of yet, but recently the World Health Organization actually recognized it as an entity, and it has become a part of ICD-11, or the International Classification of Diseases, 11th edition. Currently, in the US, we use the 10th edition, so that's why we haven't heard too much about it. And there are not many centers available for help, but that will change in the coming years, since it is a frequently asked topic, especially those of us who work in the field of addiction. Like, you go to any social gathering, it's going to be like, Doc, how do I get my children off their screens? And the answer is a little long, and we'll get to that. So let's talk about gaming disorder. So gaming disorder will have characteristics of any addiction. So most addictions have these, use phase, withdrawal phase, and then preoccupation phase before the next use. So that's how we can categorize any addiction. So when things go from just one-time use to a repetitive or addictive behavior, you get features such as impaired control, risky behavior, preoccupation, use despite consequences, tolerance, withdrawal, and so on. So what is kind of a withdrawal feature? Well, imagine you're not going to use your phone for the next couple of days. That's a little scary, isn't it? So you may get preoccupation, like, especially because you decided you're not going to use your phone. You're going to think about it 5 more times, maybe sometimes. So there's going to be this period of craving, and also just this worry that, what is going to happen? And a part of it is, unfortunately, since the advent of the smartphone, it's become such that it's become a part of our daily life. So we get our work email, we get updates on our children, we get to know what's happening in our college courses. Everything is on some app on your phone. So the use is mixed. It's not just for fun. It's a lot of it for work, and then comes the social media piece. So think about it, for coming back to gaming disorder. So the WHO classifies it into two different entities. One is gaming use not online, and gaming use online. So they try to distinguish between what is not online. So think of your typical PC game that we used to play maybe a little while ago, a few decades ago, versus the multiplayer online games that have much more rewards associated with continuing to play. They can be variable, they can be continuous rewards, they can be daily rewards. For example, if you like one game, let's call it um, game one, and that gaming device will give you daily reward for just checking in. And if you check in 60 days in a row, then you get some reward. So that's like a designated reward. Where this gets complicated and almost becomes like gambling is that as you go further in your gaming, you start getting these loot boxes that are available for money. So maybe you beg your parents or your sibling for some money to buy that loot box. And when you open it, you may or may not get the avatar that you're looking for, but you do get some kind of dopamine from what fictional things that come out of that box. It's not a real world entity after all. And this sets up kind of a gambling cycle. It's not in a casino. You're not going somewhere. You don't have to be a certain age. It's right in your iPad or device or on your phone, and it's available to you round the clock. This is where it gets complicated. So, what are some of the treatments available? Well, this again is a thought of, the evidence is emerging, I would say. There are some medications, such as the antidepressants, that we can use for some of the behaviors that are more compulsive. Otherwise, a lot of the treatments for all of the behavioral addictions are going to focus on cognitive behavioral therapy, dialectical behavioral therapy, and social support, such as the 12-step help group, whether it's Gamblers Anonymous and other groups that are available offline as well as online. There is this new concept called recovery capital, which is fascinating. Basically, what are some intrinsic as well as extrinsic resources available to you to help you with your disorder? And community support, upbringing, environment, trauma, presence or absence of trauma, and spirituality all come underneath that. And there is some evidence to show recovery capital does mean a better recovery for those below 55 years of age. So I hope this was helpful, very short. And please feel free to leave some comments or reach out to us with questions. Thank you.